Thank you for joining us for Ask a Therapist, the Blue Cross Blue Shield of South Carolina series, in which we speak with mental health professionals about issues many people face every day. I'm one of your hosts, Brindy McNair, and today we're joined by Dr. James Bouknight, geriatric psychiatrist, to talk about mental health for seniors. Thank you so much for joining us today. So, when should seniors seek professional help when things get too tough if they're struggling with their mental health?
Well, I would say anytime they think there might be something they want to talk to somebody about it. Being with a therapist is, in my view, a wonderful thing. Having somebody that you can trust to talk with and talk about your feelings and talk about the challenges that you have in your life is always beneficial, no matter how you're feeling. But if you begin to have problems with your functioning, if you just don't care about having breakfast anymore, you don't care if you stay up all night and sleep all day, when you changed your functioning, when they can't count on you to be at church for the meeting that you've been doing for 30 years, when you look at those changes, then that's a red flag. And those people probably should be seeking advice, at least from their primary care physician or provider, and maybe a mental health provider also.
So outside of professional help, how can friends and family support seniors who are experiencing mental health issues?
One of the very basic things is transportation. That it's difficult for some seniors to drive anymore. Some of them have been forbidden to drive. Traffic in places as crowded as Charleston can be very overwhelming for many people. So just a ride somewhere, a friend to do that, a friend to check on them, to call 3 times a week, just wanted to check and see how you're doing. I think for a friend to have contact with an individual several times a week and just find out how they're doing. When a friend sees the individual and they are not in their usual state of dress, their shirt's buttoned wrong, they hadn't shaved in 3 days, that's a red flag. And intervention would probably be appropriate there. Now, intervention may be rejected, that these people still have every reason to make the decisions for themselves. But I think having a trusted friend saying, you're not yourself, we need to address this, would be helpful.
For seniors who are struggling with mental health, what resources are available?
Well, of course, psychiatrists are, in my humble opinion, best. However, we have a very large nationwide shortage of geriatric psychiatrists. There are very few of us. In South Carolina, there are, probably 20, and I've trained 15 of those. So,
oh, wow.
Yeah. So there are not many of us. And many people are involved in academics. Very few see individual outpatients. And there are psychiatric nurse practitioners who, some of them are very good. Psychologists are an excellent source of counseling. Of course, psychologists, at least in South Carolina, can't write prescriptions. And if an individual needs medications, they need a physician. Some medications are tricky. They need to have an expert manage them. Medications like lithium that really, in my view, shouldn't be managed by anyone other than a trained psychiatrist. And then mental health is available, not always immediately. Mental health services are available through the South Carolina Department of Mental Health. And many of those have walk-in clinics that you just walk in the door, and if you're willing to wait an hour, somebody will see you.
Okay.
So that's a reasonable thing to do too. But don't forget technology. We now have a telepsychiatry capability in medicine so that we can see someone without them having to be physically with us.
You mentioned the just the low prevalence of people who specialize in geriatric psychiatry, and that, reimbursement is a, a likely cause for that. What other reasons do you think that there are so few people who specialize in that area?
Well, there are, I think, a lot of people who think that it's depressing to deal with older people. Fortunately, I don't. And since I'm an older person, I doubly don't think that. But well, I'll use an anecdote. I used to tell my residents and my medical students, your goals in treating geriatrics are very different. That if you're treating younger patients and your 34-year-old mother of three dies of breast cancer because you didn't do the breast exam, you're a bad doctor. If you specialize in geriatrics and your 93-year-old patient drops dead of a stroke on her way to a cocktail party in her Jaguar, you're a good doctor. That's a good outcome. People don't live forever, and to expect them to is unreasonable. So if you can help someone have a productive life until they die, that's a wonderful thing. I have a friend, I just read his obituary this morning here in Charleston. He's a retired professor at one of the universities here, 92 years old, sat in
Oh,
the pew in
wow.
front of me in church. I saw him on Sunday, smiling, laughing, having fun, drove himself there, and he died 2 days ago, suddenly. And
Wow.
that's probably a good outcome.
I mean, that's a great full life.
Yes,
You have to change your whole mindset around care when you're caring for older people, because like you said, no, we don't live forever. So it's more about quality of life than quantity of life at that
exactly.
point.
Exactly.
So kind of in that same vein, are there barriers to seniors who are seeking help for mental health conditions aside from just so few people who practice in geriatric psychiatry?
Well, I think often the main barrier is the patient themselves, that this generation to seek mental health treatment means you're, the often be called crazy, and nobody likes to be called crazy. So just the fact that I feel like I need some help would identify me as someone who's weak, who's not able to handle my own needs. And so I think that's one of the drawbacks. Sometimes family members object. You know,
Oh, wow.
my mother does not need medication. I don't care what you say. I kind of know what I'm doing, but they don't see it that way. Families can be in denial. They don't want to think that mother is having possibly Alzheimer's disease. He'll say,
Mm.
she can remember the street she lived on when she was 8 years old. How's that Alzheimer's disease? And I go, well, Alzheimer's disease takes the most recent memories, not the old ones. So I ask her what she had for lunch. Ask her what today's date is. And I think you'll see something very different.
That's interesting. And like you want to think that, family members want their loved one to get the help that they need, but I guess it's overcoming stigma really around mental health and mental health care.
It is that. And denial is strong, that nobody wants to be sick and nobody wants their loved ones to be sick. The family thinks they can care for the individual and they can't.
We kind of touched on this a little bit at the beginning of our conversation, but why is mental health care important for seniors?
Well, if you want to live a healthy, productive, happy life, um, you can't do it when you're depressed. You can't do it when you have advanced dementia. So to address those issues that we can address, some of them we can, that dementia is still a challenge for all of medicine,
Mm-hmm.
um, can make your life happier, make your family happier, relieve a burden from them if you're worried about that. So, positive mental health affects us in every way. People who are depressed die earlier. People with diseases like schizophrenia, they have a shorter life expectancy. So if you're interested in having a full, long life, you need to address your mental health as well as your physical.
That's true for people of all ages. I feel that's.
I do too.
What are some things that seniors can do for themselves to improve their mental health?
I think one of the things that we've already touched on is friendship circles, that we all need to have a circle of friends. We all need to have support. And you often hear people saying what you said earlier, that all my friends are dead. That's because you only made friends in your age group.
Right.
I would encourage seniors to make friends in other age groups. Join a discussion group, join a Sunday school class where you're around people of different ages and can form those relationships. That they'll be there for the rest of your life. Our church has groups that we meet for dinner every couple of months, and we're divided into those groups really randomly. So they're people of different ages, and we get to know people very well in different age groups, and that's helpful. The other most important thing I think the elderly can do is stay physically fit. That just because you're older doesn't mean you shouldn't be walking 3 or 4 miles a day. It doesn't mean that you can ignore your physical fitness and ignore your diet. Old and fat is a recipe for unhappiness. So as fit as you can stay, you need to do that. And there are many, many opportunities for that. Many senior centers offer exercise groups. The MUSC Wellness Center where I go, they have groups that are specifically for the elderly. So just to keep yourself fit, watch your diet, watch alcohol intake. If you are using drugs, be very careful on that, and try to take care of yourself. Keep a routine. Don't think because you're retired, staying up till 3 a.m. and sleeping until 2 p.m. is a great plan. Every now and again, that might be okay, but the rest of the world is going to be up in the morning. And if you're going to participate in the rest of that world, you need to be up.
This has been a great conversation about how to address mental health as we grow older, and for seniors who need a little help with their mental health issues. So thank you very much, Dr. Bouknight, for joining us today.
My pleasure. Anytime.
We hope this discussion can help you or someone you know. Blue Cross Blue Shield of South Carolina members can call the number on the back of their insurance card for mental health resources. We hope you'll join us again for our next Ask a Therapist discussion.